Hi, I'm Judy Tyabji. Thanks for joining us today. I was telling Hudson, no one asked me if I'd shave my head, and I feel quite offended. Anyway, today we're going to bring you a show that's very important. It's under the heading of health. As you know, we've talked about things like pharmacare, eating disorders, and parents and pregnancy. Today we're going to talk about AIDS, and it's a timely topic because on Sunday, as you heard earlier and as we will mention during the show, there's the AIDS Walk going on in many cities across the country and throughout the province. In addition to that, last night the Vancouver Richmond Health Board made a startling announcement, and we'll talk about that later in the show. But let's take a look at a background story on AIDS.
This Sunday, people from all walks of life will take to the streets to raise money and awareness in the fight against AIDS. Some people think the epidemic is over, but it isn't. The very first cases of AIDS appeared in 1979. Then there were only 2 known cases in the world. By 1984, there were 13,000, over 600,000 by 1990, more than 1 million by 1993, and 1.2 million at the end of 1995. And those are full-blown cases of AIDS, not counting those infected with HIV who have not yet developed the disease. In Canada, there have been over 15,000 cases of AIDS. Most of those, 13,000, were among men, and 11,000 Canadians have died. In BC, 2,400 cases, 2,300 among men, and more than 1,800 deaths. Unprotected sex is still a concern in transmission of the disease. 15% of men who have sex with men go unprotected. Among young men in Vancouver, that statistic is as high as 40%. And among intravenous drug users, many of whom also share needles, unprotected sex is as high as 80%. AIDS support groups have been blasting the federal government for not helping enough. At an international AIDS conference in Vancouver last year, the health minister came under heavy fire.
You know that Canada's health minister, David Dingwall, was not able to remain at this conference. He returned to Ottawa on Tuesday, suffering from the flu. On behalf of all Canadians living with HIV and AIDS, we would like to send these get well flowers with this attached message. Dear Mr. Dingwall, we are very sorry to hear that you have not been feeling well. We assure you, we know how that feels.
This year's AIDS Walk is held in 10 BC communities. Nationally, they hope to raise $2.8 million, which stays in the communities to help victims.
And we have guests with us today, and we'll be taking your calls, and we'll share with you some information about last night's decision of the Vancouver Richmond Health Board. We'll be back after a quick break with your calls to this number. Today we're talking about AIDS. There's an AIDS Walk coming up on Sunday. AIDS continues to spread throughout the country, and it's something we should be concerned about. In addition to that, there should also be concern over HIV, and to that extent, the Vancouver Richmond Health Board passed a motion last night. And today we are joined on the line by Dr. Elizabeth Wynot. And just before I talk to her, I'm going to thank our guests for being with us today. We have Eric Ages with AIDS Vancouver Island, and Jen Horgos from YouthCO. He's concerned about AIDS, and Tom McAulay, the BC Persons with AIDS Society.
Good afternoon, Judy.
Thanks for joining us. And now we're going to bring Dr. Elizabeth Wynot is one of the medical health officers for the Vancouver Richmond Health Board, and in addition is the unit manager for the Downtown Eastside area. So thank you very much for joining us.
You're welcome.
Now, last night, and I saw some of this on the news last night, you held a meeting where you came out with a very strong pronouncement about your area. Why don't you tell us what that was?
Well, it was the Vancouver and Richmond Health Board that made the pronouncement, and there was a motion put forward by one of the members, Bud Osborne from the Downtown Eastside community, that the Health Board declare a state of, well, they declare an emergency, call the HIV epidemic in the Downtown Eastside an emergency, and come up with actions suitable to address it.
Now, in that area of Vancouver, it's a very impoverished area. It's one of the places which obviously poverty is a factor, addiction is a factor, and you almost get the sense that it's an easy area for government policymakers to ignore because these people don't exactly have the ability to hire lawyers and make a lot of noise. To what extent do you think you'll be able to champion this with the provincial and federal governments?
Well, I think that the horrible part of this is that the epidemic is inescapable. We have so many thousand people who are going to be sick that it's unavoidable. And in fact, the published information about the Vancouver epidemic in injection users has elicited kind of worldwide interest and concern.
So when you say that the epidemic is inescapable and there'll be thousands of people, give us a visual of what that's like. These are people who are living on the streets, or are they people where we can find a place for them to be housed and try to help them feel better? I mean, they're obviously, I would assume, quite sick right now.
Well, these are people who live either in extremely unstable housing situations, or you're right, they live on the street or in parks. And so it's quite easy when you walk around the downtown east side of Vancouver to see people who are visibly ill and visibly affected by injection drug use. One of our drop-ins, the Vancouver Native Health HIV drop-in, which has 2 paid staff at the moment, has seen an increase in the numbers of people who, these are people who are sick with AIDS, from 400 this time last year to almost 800 people who are dropping in. And over the course of that program, which is 5 or 6 years old, about another 400 have died.
Wow. And I guess we should ask then, what's causing the epidemic? I know that Provincial Health Officer was on the program a few months ago, and he was talking about the state of health in BC and saying that poverty was a huge factor in ill health. Obviously, you've got a lot of poor people there, but what are some of the actions that are leading to this?
Well, I think the first thing is that the housing situation has been shown in some of the epidemiological studies that we've done to be a factor. People can't live safely on the street, and so even if they were to try to make themselves safer, they don't have the capacity to do so, and they're not fed properly, so they get sicker quicker, and all that sort of thing. And I think the other thing that's true is that we have a particular kind of drug use, which is injection cocaine use, that kind of exploded on the scene 5 or 6 or 7 years ago, and we're seeing the effects of the patterns of cocaine injection. People inject very, very frequently when they're using cocaine, up to 20 times a day, and their behavior and judgment become really disordered, and they're not able to protect themselves.
Now, I'm just wondering, Dr. Wynot, the first question that occurs is, how do people who are so poor that they're homeless, how can they afford the cocaine for the injections? How does that work?
Well, I don't think this is unlinked to some of the announcements that the Vancouver police chief has been making over the last few days about property crime. Vancouver has the highest property crime rate in the country, and there's very little doubt in the minds of street-level police officers and others that this is connected to injection drug use. There's also a very active sex trade. So I think that those are the ways that people make money for this. Okay,
I'm going to bring in our other guests, and I'm going to start with you, Eric, here with AIDS Vancouver Island, and let's go to the general issue of AIDS. What is the status of AIDS cases in BC?
Currently in BC, we're nearing 2,500 AIDS cases, and we're around 10,000 HIV infections, and those are people who've been tested.
Who've been tested, so people could actually have HIV and not know about it.
That's right.
Okay, and Tom, you're with the people living with AIDS, which is, for some of us, that was an interesting concept. How do you even live with AIDS? And I guess I'd have to ask you, what's the biggest challenge facing people living with AIDS?
I would say there's a few big challenges which all relate to what the Ottawa Charter defines as the determinants of health, where housing, nutrition, and poverty are big issues, and they're very interlinked. And if you're not stable in your living environment, then getting treatments and being on programs isn't a lot of help.
I guess because you're moving around so much, it'd be hard to just find you.
Well, if you're starving and you don't have enough money to eat properly and you don't have a secure place to stay, why would you be considering medications and looking after your health? You have other concerns.
A lot of people think that, you know, well, we have a welfare system, and if you're sick, you can get medical from welfare, and, you know, they'll provide you with somewhere to live. And to what extent, if you're someone who is totally removed from this, for some of our viewers who may never have met someone with HIV or AIDS, why isn't there a simple solution like that, where you go down to the welfare office and they set you up, which is the impression that people have?
Well, they do, but the income level that brings is very scant. I live on about $750 a month, which means if I didn't have friends buying me food and I wasn't connected to the community to get other services, I wouldn't be eating, because all of that money goes towards my rent. Okay. So it's there, but it's not enough. You know, we've got studies indicating that about $1,400 a month is what you need just to survive on AIDS.
Because you have all the extra expenses.
Yes.
Okay, I'm going to bring you into this in a minute, Jen, but I want to, I know Dr. Wynot can't stay with us for much longer. Where do you go from here after your announcement last night, and you know, what are you going to do?
Well, the announcement was in relation to a report prepared by Dr. Penny Perry about how to spend the $3 million that the Health Ministry has released for addressing the problem. So that will go to doing more outreach and supporting programs that are already overwhelmed, like the one that I've just described.
Right.
I think that there really has to be a concerted effort to figure out how to provide some substance abuse and harm reduction in the Downtown Eastside beyond just the needle exchange. Even Coroner Kane 3 years ago pointed out that we had essentially no access for injection users who want to, who are ready to get away from it all.
And of course, if that's linked to the property crime, if you want to stop the property crime, help the people who feel that they're driven to that to support an addiction.
That's right. And in simple statements like, well, you'll just have to decide what else you're not going to provide, because we're not going to give you any more money, and you know, who else are you going to cut off to provide the service? It's just as far as I'm concerned, unethical.
Okay. Well, we will be following what you're doing with great interest.
Thank you.
And thank you very much for joining us.
Right.
Okay.
Bye-bye.
Bye. I know that Dr. Wynot had to go on. Jen, I'm going to bring you in. There are young people who live with HIV and AIDS. Mm-hmm. What is that like?
It's quite isolating. It's hard to connect with people. I mean, nobody in high schools is really talking about this. You maybe get the 1 hour a year where a speaker comes in or a teacher addresses the issue. And then there's a lot of AIDS phobia, you know, fear of AIDS, even though people may theoretically know that they can't get it from casual contact. They meet somebody who's got the virus, and suddenly all that theory goes out the window and they start to panic. Right. So it's incredibly isolating. It's the really important part for us has been to get to youth and let them know that they can come to places like YouthCO and meet with other youth who are HIV positive, so they're not as isolated.
And are there organizations like yours throughout the province?
No, unfortunately. There are other AIDS agencies that may offer support to youth, but not a youth-run agency anywhere else in the province.
It's a bit shocking, though, to think about young people having AIDS or HIV. I mean, some people are born with it, some people contract it, you know, in ways that you wouldn't expect. What do you feel is the biggest challenge, other than the isolation, in terms of the attitude that you would encounter?
Well, right now the biggest barrier for youth in terms of preventing HIV infection is getting access to accurate and non-judgmental education and information.
Okay, and that could also be part of a biology program or health.
Right.
We're going to let you know there's an AIDS walk coming up on Sunday, and just before we go to the phones, we'll let you know where it's occurring. In Vancouver, it starts at 8:30 a.m. in Kepperley Park, which is in Stanley Park. In Victoria, 10 a.m. at Fisherman's Wharf. Nanaimo, 11 a.m. at the Pioneer Plaza. And Courtenay at 10 a.m. 5th and Cliff Streets, which is by the fountain. And it is going on in a number of other communities around the province, but these are the ones that are in our viewing area. And I'm going to show you the AIDS t-shirt, which is part of the art for the AIDS walk, so that you can see this is something, obviously it's got a lot of energy and color, and it's meant to present a different perspective, I guess. What is this a picture of?
This is a Joe Average image. Joe Average has been giving us images every year for the walk, and he basically gets inspired by the sages and gives us an image every year. Okay. This is quite a good one, we think. We like the shoe. It's always very colorful.
Especially for a walk.
And expressive.
Okay, and we'll be back with your calls and your questions to the guests, and we also want to tell you a little bit, remind you about the Provincial Health Officer's report later in the show, and link it to an announcement today about the Creever Blood Commission. We'll be back after a quick break. Today on Tyabji, we're talking about the AIDS Walk 97, which is coming up on Sunday, and the issue of AIDS HIV with Jen Horgos from the Youth AIDS Organization, Tom McAulay, BC Persons with AIDS, and Eric Aegis, AIDS Vancouver Island. And we're going to go straight to the phones because we didn't get a chance in the first segment. And we'll start with Michelle in Burnaby. Hi, Michelle.
Hi.
Hi.
I'd like to say that I've just seen recently where the government is finally stepping in to do something in downtown Vancouver for drug users.
Right.
But I also feel like the government stepping in is too little, too late. I'm a heterosexual female with a young daughter.
Right.
And the education said you want to find it, but there's not enough education. And again, the government's done too little, too late.
So you wish that they would have a little bit more so it would make it easier for you to educate your daughter?
She's only 2 right now, and not so much my daughter, but a lot of other people's children as well, and adults.
Okay, thank you for that call. Now, this is an important question, whether or not the government is doing enough. I'm going to ask you about this, Tom, because you're with the sort of the provincial umbrella organization. What is your take on this? I know that the province did appoint someone to implement their strategy. What is the strategy? I've never heard anything on this.
We haven't seen the strategy yet.
Okay.
It's not been designed. There was work done about 3 or 4 years ago, and then it kind of got shelved. Absolutely, the government's doing too little, too late. We told them about the epidemic in the Downtown Eastside at least 4 years ago, that it was going to have a huge impact, and they're just getting around to doing something now. I think an indication of the attitude of the government and the leadership is we don't have the Premier, we don't have the Minister of Health, we don't have very many politicians attending our walk this year. So I think that's telling me a message that it's not an important issue for them, and they're just not paying attention to it.
And in past years, did you have some of them attend?
Yes, we had the Premier last year, or the Premier for the last several years, and city officials and so on. So there seems to be an absence this year.
Interesting sort of change in dynamic there. Okay, let's talk to Glenn now in Campbell River. Hi, Glenn.
Hi, how are you doing?
Fine, thanks. Glenn.
My question is for Tom. I was wondering if they knew what the origin of AIDS was, like where it came from, and second of all, why is it so popular in the gay community?
I think those are questions that a lot of people want to ask, but they think it might not be polite.
Yeah, I don't know if they've determined the exact origin yet. They've traced it back through to Africa in the mid part of the century, but we're not exactly sure where and who started it, if you could put it in one place. However, it's transmitted sexually, is one of the main transmission routes. So it's not a gay disease worldwide. 70% of the global epidemic is heterosexual.
Really?
It's really a North American and European, or shall we say first world issue. I would say that's because the gay movement traditionally has been freer from some of the sexual constraints that the heterosexual community has been with, and that just allowed it to spread faster
So
through
you
that
think
community.
it's just a matter of time? Actually, I'm going to bring you into this, Eric.
Absolutely.
We were talking before the show about you know, some of the stats changing and something about heterosexual women that was increasing.
Yeah, as a risk group, heterosexual women are climbing, and young people in general are climbing. 10 years ago, the average age of infection was 32, and now it's 23, I believe, and so that's a real concern for us.
Okay, and we'll be talking more about that, I'm sure, as we get your calls. I wanted to share with you, though, that the Creever Commission, which some of you may remember was the Red Cross blood inquiry, has had a ruling today, and the Supreme Court of Canada has said that the Creever inquiry may assign blame in what we've come to know as the tainted blood issue, where blood that was tainted with HIV was given to Canadians. And the estimates are that more than 1,000 Canadians received AIDS through this system, and about 20,000 became infected with hepatitis C. And although the Creever Commission or Creever Inquiry can assign blame, they cannot point to criminal liability or neglect. That will obviously be something taken up by the courts. So that's just come out today, and I'm sure you guys would like to comment on that. We'll go back to the phones, and maybe we can talk about the Creever Commission as we go through. Talk to Daniel now in Qualicum Beach. Hi, Daniel.
Hello.
Hi, go ahead.
I was just wondering how many people in Qualicum, Nanaimo, and Parksville, and Courtney have AIDS on the island here?
Okay. How local is it?
It is local. We have people living with HIV and AIDS across the island, and I don't have the actual numbers, but I think that the island has roughly 10% of the population and around 10% of HIV infections and AIDS cases.
Okay. Jen, I want to ask you a question, and before I go back to the phones. How often do you encounter the attitude of, this is not my problem, and it's not my issue, and it really has nothing to do with me?
It probably happens every time I walk into a classroom. There is going to be a group of people there who just believes that this is somebody else's issue. And what we try to bring home to young people is, well, okay, maybe not everybody in this classroom of 36 is going to become HIV positive, but you're all going to be affected by AIDS. It's going to affect your behavior. It's going to affect somebody that you know. So learn to deal with it.
Okay. And we're going to take a call just before the break. Bill in Chilliwack. Hi, Bill.
Oh, good morning.
Hi.
I was recently, an hour or so, watching the account of the Supreme Court's ruling on the Creva Commission.
Right.
And I was listening to Janet Connors, and Janet emphasized, who was under the sentence of death, through no fault of her own, emphasized accountability is necessary among the people who transmitted the polluted blood.
Okay.
But now, when someone on your panel says, refers to judgmental attitudes,
right,
if as a consequence, unlike Janet Connors, as a consequence of an adopted lifestyle, why should they not be accountable for their own behavior?
Okay, and that's something that certainly you hear a lot when it comes to AIDS. That was the second part, is that it's your own fault because you maybe are a member of the gay community and that's how it's transmitted. And then there are some people who also will say, I mean, I'm from the Okanagan, it's a very conservative area, and I certainly heard a lot of people say, well, you know, the Old Testament will tell you that this is basically God's will. And I'm going to put that out there because there's a lot of people who feel that way, and I'd love to hear from you. Oh, Jen, you wanted to answer that?
We have a poster in our office that's one of the first things you see as you walk in the door, and it's that all people with HIV are innocent. It's a virus, it's not a judgment. Anybody can get it.
But you must hear that quite a bit, I guess.
Yeah.
Yeah, and what do you say to people who say, well, that there's a lifestyle choice involved in this? Just out of curiosity.
What's the lifestyle choice? I mean, I certainly got infected before we even knew what AIDS was, but I think there's it's the simplest thing to do is assign blame, and I think the most cowardly thing to do is assign blame. You have to look at the impact of somebody's lives and what's really being involved there. Young kids are getting infected today because schools and governments and institutions are not allowing the message through in an appropriate way that they can understand.
So what you're saying is that even if we put that issue aside for now, let's just talk about how damaging it is to everybody if we focus on that instead of focusing on, here's an epidemic, let's fix it.
Exactly.
Okay, we're going to take some more calls. We'll be back after a quick break, and first we're going to let you know how you can get more information about AIDS. First of all, AIDS Vancouver Island is at 201 55 Victoria Road, Nanaimo, BC, V9R 5N9, and the phone is 1-800-661-4337. And if you want to contact the BC Persons with AIDS Society, 1107 Seymour Street, Vancouver, BC, V6B 5S8, phone 1-800-994-2437, or if you're in the Vancouver area, 604-681-2122. And we'd like to hear from you on this subject. We'll be back after a break, and we're talking about AIDS. The question of the day today, do you know anyone who has AIDS? And we asked people randomly, and here's what you had to say.
Would it be your perception that the number of AIDS cases is on the increase or on the decrease?
I'd say that the number you hear about is certainly growing all the time. I wonder, though, if it's just been because now they know about it, it's easier to catch it and know what it is. So when numbers increase, sometimes that's why.
I would say that it's on the increase, yes. Maybe we didn't know so much about it years ago. I'm sure it was there then, but it seems to be on the increase, whether it's through getting blood transfusion and, of course, other ways.
From everything I hear, it's on the increase.
Why do you think that is?
I don't know, partially because people insist on being stupid. That's a good reason it's on the increase.
It's on the increase, I have to say, because as long as people, it's got to do with morals somehow, and some sort of the sins of the father thing passed down, and as long as it's got to do with the fall of man and all that, and I truly believe that it is it's a punishment.
And that's what you had to say when it was a random selection of people. And the lines are pretty well jammed, and we're hearing something right now. What is that?
That's actually my little medic alert.
It's not a Tamagotchi.
No, I'm on a strict treatment regime, and I actually have to stop my life at particular times of the day and take my pills. So unfortunately, this is happening during the show, but schedules cannot be changed or played with. So let's see, I've got one of these, and one of these, and one of these, and one of those.
That's a lot of stuff.
Yeah.
And what does that do?
This controls the virus and is actually helping to keep it at levels that aren't going to be hurting me in the long run, and in dealing with some other opportunistic infections, prophylaxis, and vitamin deficiencies. So this is, for me, it's 4 pills twice a day, and I'm on one of the easiest regimes. Lots of people can't manage their lives because they're taking pills 16 times a day, all day long.
Wow.
So it's pretty, so excuse me for a moment.
Well, that's fine. And so this is obviously what you were talking about when you were talking about some of the medical barriers as well, because there's a cost associated with that. And that's something that makes it much harder for people who are poor. We should talk a bit about poverty and AIDS, but I should go back to the phone lines because there's a lot of people who want to get in on the conversation. And we'll start with Tom in Campbell River. Hi, Tom.
Hi, Judy. My question goes back to the beginning of the show there, where they're talking about street people and IV users being the biggest portion. What about the number of professional and working people that are hidden behind closed doors that have problems with IV use?
Well, I think that's a really good question, the hidden drug issue.
Well, I don't know so much about older professional people, but it certainly comes up when you're dealing with youth, when you go out into suburbia. I know I've been asked, as I walked into a classroom one day and the teacher said to me in front of the students, we don't really need to talk about the IV drug stuff here because these are pretty good kids. And I was stunned. I said, what does that have to do with anything? I mean, anyone can experiment.
Right.
I don't know if you guys want to talk about the hidden professionals.
Yeah, go ahead, Tom.
I could actually say that I think I represent that hidden group because I did IV drugs for a couple years in my youth, and I wasn't on the street. I wasn't down and out. I didn't visibly in it. I was what I would call a weekend partier, and it was very taboo to talk about that, except amongst the group of people that I was involved in with that. So it's very hidden, and people don't see it, but it exists in great numbers, I think.
Okay. We'll talk to Gary now in Victoria. Hi, Gary.
Hello.
Hi, go ahead.
Yes, I have a couple questions that I'd like comments from your panel.
Okay.
I would like to know why Hep C doesn't get as much attention and, more importantly, funding.
Okay.
Also, I'd like the panel to speak to the medical problems of Hep C sufferers.
Okay. Well, thank you for those questions. And in fact, we had pulled a story about that today because that's also related to the Creever inquiry. Why is it that something like hepatitis C, I have to tell you, I only have started hearing about it in the last little while, and it's one of those hidden issues. Eric, you haven't been speaking up much.
Well, I mean, it's a bloodborne virus like HIV. I think back in the early 80s, people were dying mysteriously and dramatically, and I think the various communities in which those people were becoming ill responded, and HIV was what the issue was. And so community AIDS organizations around Canada sprung up around what was a devastating and very rapid trajectory through infection to death. So I think that's where that comes from.
So perhaps it just takes a while for hepatitis C to become more high profile. You know, it's certainly something we're hearing a lot more about now, and I think we will continue to hear about it in the next while.
I think we're hearing about it now because it's rampant in the injection drug using community, which is one of the large problems about that community with this issue. Is it's not just about HIV. It's about HIV and co-infections with Hep C and tuberculosis and the poverty and the addiction and all of those issues. So it makes it all that much more complex.
Okay. We're going to talk to Rodney now in Surrey. Hi, Rodney.
Hi.
Hi.
My question was, a couple of years ago on some talk shows in the United States, there was a doctor that was stating that people who were continuously going to the doctor and getting antibiotics, that this could have been a cause for people getting HIV. And another point was that the tuberculosis, all these diseases that are coming back that we thought we licked, would antibiotics have anything to do with depleting people's immune systems so that this could possibly be a fact?
Okay, that's an interesting question, because there are a lot of people who think that sometimes conventional medicine is worse than, you know, trying to find an alternate therapy. Any thoughts on that?
Well, I know that the issue around TB is not so much that TB has depleted the immune system, or antibiotics have depleted the immune system, and therefore you would catch it. But when your immune system is depleted, it allows these organisms to become more active.
Right.
So it's very difficult to sort of say that.
Well, you can't.
That's
you can't necessarily. Nobody would say it definitively.
Yeah.
We don't have enough time for another call before the break. But I want to ask you this: poverty and HIV. I mean, a lot of people, like we heard the guy in the on the street saying it's punishment. We know the people who say there's that the biblical thing, and I'm not sure what kind of God they believe in. But given all of that, to what extent does somebody's isolation and loneliness and poverty end up making them very vulnerable to the addictions that then lead to the disease that then make them more vulnerable? I mean, is that the sort of thing that you're trying to deal with as well? Or?
Oh, absolutely. I mean, self-esteem is one of the major factors in defining your risk behaviors. If you don't feel good about...
What's a risk behavior then?
Well, risk behavior would be, for instance, going out and getting drunk in a bar at night and taking somebody home and not being totally controlled and aware and on top of things, or you're in a sexual situation, the dynamic, who has the power, who has the control. Often people with low self-esteem will do whatever their partner wants for that false sense of love and protection.
And that makes them more likely.
Much more.
Okay, we're going to take a quick break. We'll take more of your calls, and we'll talk a little bit about what the provincial health officer had to say on this back after break. And we have a few more people on the street who wanted to share with you their ideas about AIDS, and we thought we'd share that with you right now.
According to the information that I've looked at and read about, I think AIDS is on the increase due to more increased drug use.
What I hear and read in the paper, it sounds like it's on the increase. I think there's no doubt about that.
I think it's just at a level right now. Yeah, that's rather difficult with the third world countries, with it being so prevalent there. It's hard to make a fair assessment.
I think there's more people seeking help and stuff for it. There's more information out there for help, but I still think it hasn't reached its peak yet.
Why do you think that AIDS is still on the increase then?
Addicts, their main concern is getting a fix. They're not worried about the health consequences.
And so there's a lot of the things that we've talked about here, and the lines are jammed. I'm going to go back to the lines in just a sec, but I wanted to share with you this year's Provincial Health Officer report by Dr. John Miller. Some of you were with us when he was on the program. We were talking about that. One aspect of it was recommended actions for disease and injury prevention. And there's an economic argument, even for those who think all homosexuals should die of AIDS. There's actually an economic argument to say that the government should get involved with helping out. But there were recommended actions for disease and injury prevention included, for example, HIV infection, sexually transmitted diseases, chronic disabling conditions, which sometimes occur when you have a suppressed immune system. And the premise of that was very similar to what we're hearing coming out of the Vancouver Richmond Health Board, and that is that people need a place to live, they need some food to eat, and they need people who, as they say there, give a damn, which was, I think, the title of the report. And we'll go back to the phones, and then you guys can talk to some of those points. Let's go to Samantha in Victoria. Hi, Samantha.
Hi, can you hear me?
Yes.
Okay. Years ago when I first heard of AIDS and HIV, I was in my teen years, and I could never understand why we weren't getting sort of inundated by constant information on symptoms and as well as how you might contract it, instead of like all this crap that comes to the mailbox all the time about sales and everything under the sun. Why, you know, this is a plague and it's plaguing us, and it is a fact of life, and people have it, and we need to be sympathetic and educated. Now I don't understand, now that it's in our lives as a daily part of our lives, there is people that are living, from what I understand, with HIV, but living fairly normal lives and keeping themselves healthy so they don't have to right away die of AIDS or maybe prolong their life as much as possible. Why aren't we getting this information about the hope that is out there and what people can do to keep themselves at a point where they can live a good life, and we can stop looking at people that have AIDS as having a death sentence and leaving them alone and start like caring about them just like everybody else? Okay, well, that is a very passionate statement. Now, I mean, you probably all have something to say about that. Let me start with you, Eric.
Well, it's true that there is some hope, but there's hope for a few. Not everybody can tolerate the medications that Tom has just taken earlier. And also, people spend their lives medicalized for the rest of their lives. However, yeah, there is hope, and I think that everybody within the AIDS community is desperately clinging to every new piece of news.
And Jen, when she talked about being inundated with information, you're trying to get the information out to young people. Right. This must be something that frustrates you.
It really, really does. I said before, you know, we get 1 hour of the entire school year to address an issue. That
you got as much time on the show.
Exactly, yeah, and we're probably reaching more people right now, yeah. People have so many anxieties about drug use and about sex and about youth that they're really afraid to get out there and talk about it and give youth real practical information which they need to protect themselves.
Okay, we're going to talk to Veronica now in Campbell River. Hi, Veronica.
Oh, hello.
Hi.
A while back, I took about 6 children who are fairly well educated. I mean, we talk about AIDS at the dinner table and stuff. I took them to see Pulp Fiction, a rather gory movie. Anyway, while we were sitting there, one scene was an extreme close-up which filled the whole screen of the needle going into the man's vein and then the blood coming back into the barrel and swirling. And every one of those kids turned to me and said, "That's how you get AIDS." And here's a group of kids who have had all kinds of information. They're well aware, but you know, I wonder, are we getting through? And is there any new film or video productions coming out now addressing AIDS?
Okay, I think that's an excellent question. I'll let you answer that, Tom. I mean, are we trying to, for a while there was so much, about 10, 12 years ago, that we heard about it all the time. And now it seems like there's not as much of a human face on it.
No, exactly. And I'm really quite concerned that our federal government hasn't taken a stance on this either. We don't see any advertisement on the street. We don't see AIDS mentioned anywhere. So it's really like our society has put their heads in the sand.
So you're saying that there isn't something on the horizon right now?
I don't know of anything in particular. There are always little projects going on in community and community groups doing this sort of thing. But you know, we just don't have the resources to have a full public health campaign.
And speaking of that, the AIDS Walk is also a fundraiser, and the money from that will be?
It goes to our, excuse me, our Complementary Health Fund, which is a fund we set up that allows our members to access money to pay for medical treatments or alternative complementary treatments that the government doesn't pay for.
And that if they're poor, they can't afford otherwise.
That's right.
Okay, so a little bit more dignity in their lives.
Yes, exactly.
Okay, we're going to take a quick break. We'll be back with more of your calls. We're talking about AIDS and related issues. And coming up in future shows, Monday, medical service for the disabled, and then we have our Information and Privacy Commissioner, and we will shock you with that one. And then we'll be talking about the NISHCA in coming weeks, and that's about whether or not there should be a referendum when we're settling Aboriginal treaties. And that actually, you wanted to mention something about the Aboriginal community and HIV.
Yeah, we're talking a lot on this show about the epidemic in the Downtown Eastside with injection drug users. We've mentioned women and youth, but there's a huge problem in the Aboriginal community, which is quite linked to the inner city problems.
Right.
But the on and off reserve issues and the issues of education and reaching those people is very big, and I just wanted to get that out as well.
I think that's an important point to make. With Aboriginal social issues, it's almost like a standalone thing, and we need to understand what the root cause is of some of those things. Okay, now Michael from Vancouver is here, and you're picking up your own long distance costs, so you get to go first.
Hi, Judy. I must commend you on your show, actually. I just started watching it. I have a question. Is there an organization that helps people or can direct people on how to deal with being dismissed because of being HIV. I worked for a very large corporation,
right,
and was dismissed because of that reason.
Right.
And even though I was billing still over 50 hours a week, I was dismissed because I was missing some time because of my health.
Okay, well, that's an excellent question. Goes to what it's like to live with it.
I can say that he could phone our office. We have an individual advocacy department which has right now over 380 cases on file, open cases, dealing with all kinds of these sort of legal issues. So,
and it really is a civil rights issue.
Yes.
So there's protections
and human
in
rights.
it. It's a human right now, though. And in fact, when we did a show with the Human Rights Commissioner, they were trying to amend the legislation so that he would automatically have grounds for a human rights complaint. Right. But right now, you certainly have a complaint under the Charter of Rights and Freedoms, which means it's a civil suit. Yeah. Okay. Let's talk to Patricia in Victoria. Hi, Patricia.
Hi. I know in Ontario that they started selling needles over the counter with the Band-Aids to encourage drug users to constantly use clean needles. Do they do that here in British Columbia?
Oh, good question. Eric.
The caller's from Victoria. Actually, we distribute free of charge over 250,000 needles a year in downtown Victoria to a client base of 3,000 injection drug users in Victoria. And that's happening in Vancouver and Nanaimo and Duncan and a couple of other centers across the province.
Now, what's interesting and related to that issue was a story that came out in today's province newspaper where there's a quote from Dr. John Blatherwick, and they're talking about the fact that even with the needle exchange program in Vancouver, they're finding that drug users are continuing to have the problem, especially once who are using the exchange. Yeah. And they think that that means that there aren't the resources to actually administer the program properly. Well, that's kind of a shock. What's the point of having a program?
Yeah, I think one of the issues is the some of the needle exchange programs are a one-on-one exchange. So you bring one in, you get a new one in return. The epidemic in Vancouver has been identified with cocaine. People using the needle 20 times or more a day. One needle isn't gonna do that. So there really needs to be a more
maybe an education program with that. Okay, let's talk to Linda now in Port Alberni. Hi, Linda.
Hi.
Hi, go ahead.
I'd like to know how many babies are being born with AIDS and how many older children have it.
Yeah, I think that's a really good question.
I looked at some statistics this morning, and it seems like less than 0.5% of all HIV infections are perinatal infections.
Meaning before birth.
Right.
But it's still occurring. That's I mean, you know, the fact that it's even there is something that's really interesting. Okay, we're going to talk to Larry in Campbell River now. Hi, Larry.
Hi. I just wanted to comment on that one gentleman that said this is God's punishment, and I don't believe that at all, because our cancer patients being punished for their illness,
right.
And I think anybody that lives with this on a daily basis is a pretty brave person. And I had one question. I had heard on the news where actually in the gay community, I heard that the AIDS had sort of leveled off and was not on the increase.
Okay, and that's a good question, because there was actually a news story the other day, and I think, Eric, we were talking about that. Or actually, Jen, did you have a comment on that?
Well, I think that if we heard the same news story, this gentleman and I, it is true that within the gay older male community, for men who identify as gay and bisexual, the numbers are leveling off. But where you look at really young gay men, they're invisible in the school system. I mean, all gay, lesbian, bisexual, and transgender kids are just not even addressed in the community, in the curriculum. So they then have to come to, you know, connect with a youth group somewhere and get information from those youth groups. And I mean, queer youth groups are very underfunded in this province, so it makes it really difficult.
But they can go to an adult organization and get information if they needed to.
Well, they could, but it's really intimidating, and adults are dealing with different issues than youth are.
Okay, we're going to talk to Dan now in Courtney. Hi, Dan.
Hi. I'd like to just say that I think condoms should be more accessible to teenagers.
Okay. Okay. Well, that's his whole statement. You're all nodding. Who wants it? Why don't you take this one,
Well, I
Tom?
think also, too, what I've heard in a provincial group, meeting recently was that some of the larger groups can afford to buy condoms for distribution, but a lot of the smaller groups around the province can't. So there's, you know, whether it's going into schools or having them available anywhere, we really do need to promote this as a safe sex
That could be like a whole
option.
show.
Yes.
That one call. You could give me a whole show on that one call. Yeah. And we're like in the last call here. We have Chris from Campbell River. Hi, Chris.
Hi, Judy.
Hi, go ahead.
Yeah. Grant, who you were speaking to at the beginning of the show.
Right.
He's got it right. It did come from Africa.
Okay.
But what he didn't know is that it's a monkey virus.
Okay, I'm going to let them respond to that. Certainly we've heard a lot about that somehow it was passed from monkeys, but then there's also, that's been debunked, hasn't it? Okay, okay, Eric, so you seem the most keen on this.
Well, I just think what I'm less concerned about the origins of the virus than actually treating it, and I think the treatment problems are much more urgent and complex and need immediate attention.
Okay, and to that end, I want to thank all of you for joining us and to wish you well in trying to help people who need help without judging.
And we'll see everybody at the AIDS Walk.
And that's what we're going to let them know right now, is that if they want to get involved with the AIDS Walk on Sunday, Vancouver, and registration is at 8:30, and let's see if it's separately? Separately Park in Stanley Park. Victoria at 10 a.m. at Fisherman's Wharf.
Registration at 9.
Registration at 9. Okay, Nanaimo, 11 a.m. Pioneer Plaza. What? No corrections?
Registration at 10.
Courtney, 10 a.m. 5th and Cliff Streets by the fountain. And it will be going on in most communities, most major communities around the province. So thanks very much.
And thank you for bringing this issue to light.
Well,
it's nice to know we have some support.
Okay, we're going to take a quick break. We'll be right back. On Monday, last Monday, we did a show about homosexuality and where it was appropriate to teach tolerance. And as I said, I believe we have to tolerate each other, all of us. But beyond that, we have responsibility to each other as human beings. And it's very important not to be laying blame when it comes to something like AIDS. And what strikes me as odd is how frequently people will quote the Bible. Well, it's in the New Testament that Jesus said we have to love each other as we love ourselves. And it's our responsibility to take care of each other. And if we want to start talking about Christianity, then the Christian ethic is that we reach out to each other. When it comes to something like AIDS, all of us should pitch in because it's a serious problem. I'm Judy Tyabji, and that's my opinion. What's yours?